With an increasing number of states legalizing marijuana, more Americans are using it than ever before. In fact, a recent study shows that daily marijuana use has now surpassed daily drinking. But on today's episode of Grieving Out Loud, a grieving mother has an urgent warning. If you do use marijuana, be careful where you get it. One bad decision could change everything.
When Andrew received the marijuana, it was given to him by someone he knew, and he had known already for about 2 years that he had lived in Maryland. So he had known this person.
Despite knowing the person, Paula Santos-Young says her son had no idea the marijuana was laced with a deadly drug.
When you go online and you go to Snapchat or you go to any of these other platforms and you're getting the marijuana from someone you don't know, say goodbye to your family.
Well, Paula, I had a mutual grieving mother who I'm working on some national legislation with in support of some national legislation that she's working on. And she mentioned to me, you have to talk to Paula, because we started talking about marijuana and some of the dangers with illicit marijuana out there and some of the things that people don't want to believe is happening with marijuana. And she says, you have to talk to Paula because her son died after smoking marijuana laced with fentanyl and xylazine, and she's got proof. And I'm like, yes, I have to talk to Paula. And then it turns out you're doing this advocacy work just like the rest of us. So many of us in this boat now, we're all rowing together. Some of us, our stories may be a little bit different, but we all want the same outcomes, right? But thank you so much for joining me.
No, thank you so much for having me. I so appreciate you taking the time to reach out to me and just to get the messaging out, because it's important. It's important that people understand. And I say this all the time, although we are not having a lot of cases happening with the marijuana being laced with fentanyl, thank God, right? Because it's not like what we're seeing with the pills and coke and meth and so many other things that fentanyl isn't in, and vape pens. Yes, it is a small number, but it's still a number and it's still happening. And it's happened in many different parts of the United States and many different states.
In fact, Emily's Hope has reported on several cases of fentanyl-laced marijuana. Even in my home state of South Dakota, the Division of Criminal Investigation warned the public earlier this year about marijuana that was potentially laced with opioids discovered in the eastern part of the state.
One of the biggest things that I know a lot of parents say all the time, especially when they talk to us, when they found your child, what was next to your child? Well, with my son, I can tell you that the only thing that my son had on him when he was found was the blunt that he had been given, his wallet, and his cell phone. In fact, the detectives told us that the blunt was not even half smoked when they found him. So when you hear something like that, especially to people out there who might be smoking marijuana for medical purposes, if you hear, wow, not even half smoked, then obviously something was wrong. Something was going on.
Right. There's a lot to unpack here. So I wanted to start with the fact that we do know that there have been deaths reported across the country, even though there is a huge push for cannabis, right? There are a lot of people that strongly believe in cannabis, that want to use it for medical purposes. I think nobody is trying to deny people, adults, use of cannabis for medical purposes. But that has also created a black market. And there's always been a black market, obviously, when it was illegal, but there's a black market because it's cheaper, right, than if you go buy it at a dispensary. Correct. So there's this black market out there, and that is the marijuana that we're seeing being laced with fentanyl in these cases where somebody like your son, Andrew, actually smokes and dies. And he did have a medical marijuana card. Can you talk to me about Andrew and why he had a medical marijuana card?
Absolutely. So my son, when we lost him, he was 33 years old. In fact, this Saturday will be 3 years. So I apologize. This was a tough week for us, as you know, unfortunately. But he was living in Maryland, and he was living there because he was a basketball coach. Andrew had loved basketball. That was his passion.
Andrew was so passionate about basketball that he started an organization called Achieve Greatness 3 years before his death. His goal was to train and educate people of all ages on basketball skills.
Skills assessment, training, one-on-one. It kind of became almost like a mentorship where he worked with kids from elementary all the way up to college level. And he loved it, and he was going to do even greater things with Achieve Greatness.
Andrew was physically active and passionate about teaching others his favorite sport. But after a serious car crash, he was issued a medical marijuana card.
The car actually flipped over, and he could have died then, and he didn't, thank God. But because of that, he was diagnosed with PTSD, anxiety, and some social depression. So Andrew was not someone to take a pill ever since he was a child. I mean, even giving him a shot, they would need 4 to 5 people just to hold him down to give him a vaccine when he was younger. So his doctor at the time said, hey, listen, why don't we apply for a medical marijuana card? Because you have these diagnoses, I've given them to you. Let's get this done. And that's what he did.
While Andrew had a medical marijuana card, Paula says on the day he died, he didn't go to the dispensary himself. Someone else got the marijuana for him.
When Andrew received the marijuana, it was given to him by someone he knew, and he had known already for about 2 years that he had lived in Maryland. So he had known this person. They had actually played basketball together. I will tell you that even on his phone, there was a dialogue of this person telling him, hey, I'm going to go pick this up for you because I know you're working. I'm going to get it at the dispensary. Well, unbeknownst to us, I don't know if he got it from the dispensary or not, because to be honest with you, unfortunately, nothing's been done. We haven't received any justice. The police did have that person at the police department. They did speak to him. And what was said to me is, well, Mrs. Young, what the hell did you expect? Did you expect a different outcome?
So who told you that? The police told you that? What did you expect? So the person who provided your son with the marijuana laced with fentanyl, it turns out, and xylazine, correct, you later found out, faced no consequences whatsoever, even though there was a dialogue on the phone, there was some proof on the phone. No consequences.
Nothing. No. And I was told by the head detective, what the hell did I expect? Did I expect a different outcome? Because they already categorized him into, as we know, the stigma, an addict. And this is one of the things that I continue to fight every day. What I'm doing with Achieve Greatness is fighting that stigma, because fentanyl is affecting everyone. And even if someone is suffering from substance use, they're a human being. For God's sakes,
right?
You know,
well, and my daughter was suffering from substance use disorder. In fact, we were 3 days away from holding an intervention because we knew something was horribly wrong. But substance use disorder does not define a human being. It's a disease of the brain. And that's some of the work we've been doing for years to try to reduce the stigma. But your son had these mental health issues. He was given a medical marijuana card. He thought his friend was getting marijuana from a dispensary. We don't know where his friend got it from.
Correct. No, we don't.
And he ends up dead. The only thing on him was this, he smoked part of this joint. So what did the coroner's report say?
So the ME report that came from Baltimore, I actually was in constant communication with the doctor. I kind of demanded to talk to her because I wanted to know, you know, especially when I got the reporting that he also had xylazine in his system. I reached out to her and I said to her, I said, can you please explain this to me? Because I'm a little lost. You know, did he have anything else in his system? Did he ingest a pill and maybe we just don't know? Or did he have, you know, was it a needle mark? Was it anything? And she said, Mrs. Young, he had nothing. Absolutely nothing. There was no marks on his body. There was nothing in his stomach. The only things that was in his system was the fentanyl, the marijuana, and xylazine. That's it.
And xylazine is being put into these drugs to extend the high. Right. So that's the reason for the xylazine, is to extend the high. And it's a way, I don't know, to keep your customers coming back or something if they don't die. Yes. I mean, it's just, it's insane.
As one of the nation's strongest financial organizations, First Premier Bank and Premier Bank Card have the strength to do good. We support nearly 700 organizations and nonprofits. Our employees give more than 30,000 volunteer hours annually. And we are continually seeking ways to make South Dakota an even better place to live. It's the Premier way. First Premier Bank and Premier Bank Card.
After losing her son to fentanyl, Paula says she has not only struggled with overwhelming grief, but also faced doubts from others questioning whether Andrew's death was truly caused by marijuana laced with the deadly drug.
I fight this every day because I have had to reach out to medical examiners here in Massachusetts, the district attorneys, sheriffs, law enforcement, Massachusetts State Police, FBI, DEA. They all talk about it because they're seeing it. They are not saying that they're not seeing it. They are saying, yes, it is true. We have seen it. So to continue to have people rebuke the fact that it's not happening and then try to tell a parent who lost a child this way in this manner, it's kind of disheartening, right? It's kind of like, okay, so you're telling us that we're crazy, that we don't know what we're saying, and the medical examiner is lying because they could lose their license. And that's one of the biggest things right now that I personally, as a parent and with our organization, that we're pushing for is, we're not telling you that it's happening every day. We're not even telling you that big busts are being found, right? But what we are telling you is that there is proof that it has been found, has been recorded, has happened in other states with other parents. So please stop telling us that this is not happening.
Yes, and I think you have a huge group of people who support cannabis. And every time we put out a story, when we do news stories on our website having to do with the opioid epidemic, fentanyl poisonings, we talk about addiction, we do substance use disorder, we talk about studies on the brain and things like that. And we've put a couple stories out about, long-term effects of cannabis on the brain. Well, the pushback we get from just even reporting about this, university study, nobody wants to hear anything negative about cannabis. And especially the people lobbying and earning a lot of money off of cannabis don't want to hear anything negative. But the fact that you have to defend how your son died, or people think you're crazy or a liar, you even carry the coroner's report around with you?
Yes, I do. I do. And it's pretty sad, right? It's pretty sad and it's pretty disheartening. It's kind of like someone coming to you and saying, oh, well, you didn't lose your daughter the way you say you did. Show me proof.
Well, I've had people tell me that it was suicide, and I certainly am compassionate for families who have a child who completes suicide. But there is a difference between someone completing suicide and someone getting a drug and not knowing there was fentanyl in it. It's just like you could conceivably drink yourself to death, yes, if that was your intention, right? Or you could go into a bar and buy a drink and someone could have poisoned it. I mean, those are the distinctions, right? So I have had people say those kinds of things, and I'm like, no, she thought she was getting one drug, and sadly it was heroin. We didn't know that she had been using that substance. She didn't know she wasn't getting heroin. She didn't know it. And she was poisoned. And your son thought he was getting marijuana, and he was poisoned. Certainly he wouldn't have been seeking out fentanyl and xylazine.
Exactly.
And no indication of any kind of substance use disorder in your son.
No, none at all. He had never done anything but smoked marijuana. And again, with the ME report and the toxicology report, all of that substantiated exactly what the ME doctor had already said to me on the phone. People need to understand that fentanyl and what's happening and continuing to happen in the United States, this is not an addict problem. This is an everyone problem. I just had to have a meeting last week with a couple of the senators and congressmen here in Massachusetts on a bill that I'm pushing forth. And I said to them, you guys need to change your verbiage. You need to change the way you speak, because this is not a Democratic or Republican issue. This is a United States of America humanitarian issue. Stop.
It's a public health crisis is what it is. And I would like to be able to now, I speak to students all over the country. I've spoken to thousands and thousands of students. And in my presentation, I talk about the struggles with my daughter and what was happening and how worried we were and why we didn't know everything because of the shame surrounding substance use disorder. But I also show them kids who've died after buying a pill off of Snapchat. And I'd like to show a picture of your son and say, and it can be laced in weed too, because I think kids think, oh, that's safe. That's natural. That's safe. It's okay. And so I think it's wonderful that you're sharing your son's story, and I want to share it more with your permission.
Oh, absolutely. Please. Because, I mean, today, and you know the facts just as much as even more so than I do with vaping, right? I mean, here in Massachusetts, there was a study done and the kids are starting to vape at 7 years old.
3rd grade in my school district and probably younger in other places. And, you know, it's scary. And what they're getting in those vapes, if it's marijuana. And so we don't know. In fact, Emily's Hope has reported on multiple cases where kids were hospitalized after using vapes laced with unknown substances. In one instance, a school nurse had to revive a New York high school student with Narcan after the teen took a hit from a vape suspected to contain fentanyl. In Dayton, Ohio, 2 middle school students were hospitalized after using a vape pen at school. These growing dangers have turned Paula into an advocate for raising awareness about illicit substances. After her son's death, she not only kept his nonprofit Achieve Greatness going, but gave it a renewed purpose. The organization not only sponsors youth basketball camps and other sports, but it also raises awareness about the dangers of fentanyl, substance use disorder, and the opioid epidemic.
So we formulated a 501c3 and a 504c3. So we actually have both. We have it patented, we have it trademarked, because he created the actual logo, the mission statement, everything around Achieve Greatness. So we weren't going to lose that. It took me a year, to be very honest with you, to really go into this advocacy work, education, prevention, awareness, because I needed to, and you know this as a mom, right? We are grappling with the unexpected that you never, ever want to hear. And then you're dealing with a bomb that just went off in your home. And my husband says it best. And he's like, I had to be the one to stand behind her and try to pick up the pieces of the bomb that just went off in my home. And the biggest thing for me was when I was told by the head detective, well, Mrs. Young, what the hell did you expect? Did you expect a different outcome? That's where I knew I had to do something. It was going to take me some time. I had to go through my process, as we all do, and we never get through it. But I knew that if he's speaking like that to me, how many more other parents has this person made this comment to? And how is that even okay?
It's not.
Right. And that's what really the drive is for me, to be honest with you. It's saving a youth. It's saving a generation. It's getting the messaging out. And even when some people don't want to hear it, as they don't, we're not going to wait for those that we vote in. We have to do something. We have to be the boots on the ground, grassroots movements to make this, viable for people to hear this message and for people to understand the crisis that we're in. I mean, here in Massachusetts, we have a lot going on, as everybody knows, but the messaging can't stop. I was at an event just 2 weeks ago with a town next to me that's about 10 minutes away, where the police chief of this town was there, and it was a school committee meeting. And he said, we don't have a problem. I don't even know what fentanyl is.
Well, talk about burying your head in the sand.
Oh, yeah.
I live in a rural state, and we have little tiny communities that have been impacted by fentanyl and overdose both, but, have lost young people. And there was a little tiny town where in 1 week, 2 high school kids overdosed and were revived. It's everywhere. It's everywhere. And people that want to think otherwise, especially somebody in law enforcement, that just shocks me that somebody would say that.
Yeah.
Are you passionate about keeping kids safe and informed? Emily's Hope is proud to introduce our K-5 substance use prevention curriculum, designed to educate young minds about the dangers of substance use. This engaging program lays the foundation for a healthy future. Visit emilyshopeedu.org to learn more and help bring this vital resource to your local schools. Encourage your school administrators and counselors
to explore our curriculum today. It's part of our mission. Together, we can make a difference.
And I think, you know what happens, and this is what's happening, and I've heard it being said to me. I won't share by who, but I have had folks in legislative here in my state say to me, well, Paula, you need to understand that we don't want to talk about this all the time.
Right. So here's what I think, Paula. I think there are so many of us who've lost kids in this way. I mean, thousands and thousands and hundreds of thousands of us parents, right? Because, we lost 100,000 last year. And when my daughter died, it was 72,000, so you multiply all of those deaths and then all the family members. And so it's impacted all of us. And to us, it's the number one problem and issue in this nation because we are losing so much potential. I mean, all of these, it's the number one killer of young people. We shout it from the rooftops, right? But in today's age, there's so much competition for your attention. Yeah. And especially now, so many things are happening so fast and so much is changing. And there are wars and there are economic issues. And I think people get really weary, right? They get overwhelmed and they don't want to hear about it. They don't want, not one more thing. And what can I do about that? And I mean, I think that is kind of where we are in this country. That's my sense anyway.
Yeah. And I definitely agree with that. And I understand that. But that doesn't mean the messaging stops, right?
No.
Because like you said, we've lost a whole generation and we continue to lose unsuspected people from fentanyl poisoning. Because look, you and I right now, and we know this because of what we do, there's almost, 50,000, I think the DEA said, 50,000 pharmacists out there that are on the black market where you and I can go into and order anything we want. And we'll get it delivered right to
You're talking about online pharmacies,
correct.
Yeah. Mm-hmm.
Yes. And we'll get it delivered right to our home by UPS, FedEx, or mail. So when things like that continue to happen and you see it, and I have the former Massachusetts hazmat director who does a lot of the events with me, and he says it all the time. He says, look, I can be at this event right now, order fentanyl on the black market, and it will be at my house in 2 days. And he gives the monetary amount. He always says, look, I can order $1,200 and the street value here in Massachusetts is $1.8 million. And when you hear that, people look at you and they're like, oh my God, I didn't know that. Or when you're starting to show the emojis and now you're showing it to teachers or, people who don't even know what they mean, and that a palm tree and a football and a soccer ball and a basketball all mean a different type of drug that child is now getting from the person who they just, messaged on Snapchat or any of the other platforms. And these are the things that we always tell our parents. And when I speak, I always tell the people at the events, please understand that we are here to educate you. We don't want to hear of any more deaths. Every day, you and I, I'm sure, just from the messaging of the parents that we've become familiar with, are getting messages of a new person that has passed away. Every day we're getting these messages. So it's almost like a form of PTSD for us.
Right. And every parent, whenever I've been at a conference, I mean, we've been brought in by the DEA and all these different things. And whenever I've been around other parents like you and I, we've all said the same thing. The reason we're doing this is because we don't want it to happen to anybody else. And that is certainly when I started on this 7 years ago. And I thought I could make a bigger difference so fast. I was so naive. When people were still dying, like you talked about, I thought, oh my God, why are people still dying? I'm shouting this from the rooftops. Yeah. I'm talking to everybody. I think there is a lot more awareness out there now than there was in 2018 when my daughter died. I think we certainly have a lot more naloxone going out, and Emily's Hope is distributing that. But I don't think we've done enough the overdose deaths nationwide are going down, but yet in my state they were up. We need to get these numbers down to next to nothing, and it shouldn't be this way. But we have to do enough to stop the demand, to educate people, stop the demand, reduce the stigma, just make harm reduction available to whoever needs it, and just really turn this tide around. We have to have people care enough. And I think that's where we were talking about earlier. I think sometimes there's just apathy.
Yeah. And and I saw something was sent to me today. It says, where do you bring hope when hope seems to be lost? How do you bring it back? And, one of the things I said to the person, I said, well, start one person at a time. You bring, parents together like myself and you and so many others. And we let you know that, although because I tell people all the time, I'm broken. I'm shattered. I will never be the same Paula that you knew prior to losing Andrew. But please also understand that with that comes compassion and empathy. And anything that we can do, and even with yourself, what you do, we're here to try to save you. We are here talking to the mother and the father of the child who they haven't lost.
And I always say we're the walking wounded. I actually wrote a blog about that. Yeah, I'm not the person I was. I'm certainly more empathetic. I have more compassion for people. I'm less judgmental. In some ways, tragedy has shaped me for the better, right? But I don't do this for any personal glory. So it's just every day is you get up and you do what you can to try to save that one life or to make a difference in one life. And I think that's what you have to keep in mind. I always say we're in the empathy and hope business. The name of our organization is called Emily's Hope. And I really do think that is what we're in the business of, just to give hope and empathy just to one person, one family where we can make a difference. And I know we've done that, even though I want a big dramatic change, right? I want a big dramatic change. I want all kinds of safety and safeguards and in place to protect our kids. But we can just keep putting one foot in front of the other and working toward that goal. And I think together, eventually we will reach it. We won't do it on our own. You and I won't do it on our own, but together I think we can.
Oh, absolutely. And then you have so many organizations, even federal organizations, because we have someone who is in the DEA now, Derek Maltz. Derek Maltz has been a huge supporter of families around the fentanyl crisis. And, he's been on TV. He's been all over TV and every channel possible, speaking not just of the crisis, but what the cartel is doing with the supply, and also speaking about the fentanyl being in marijuana. And it's interesting because I sent a message to him and I'm like, hey, when are you going to get your folks talking about it? Because it needs to happen. Because you talk about it, Derek, and I appreciate you for doing that because it's true. But now the DEA needs to talk about it because unfortunately you still have some agents who are going to events who are saying that that's not true.
Right. And the other thing I heard from Derek at a conference in D.C. just last month was that the marijuana, not only we have cases of it being laced with fentanyl, as in the case of your son, but the Chinese are also spraying it with these horrible pesticides.
Correct.
So people are getting, these cancer-causing agents as well. So you've got to be really careful where you get your marijuana. I mean, if you are a person who uses it in a legal way, we need more people to talk about this, more people to recognize it. But you're going up against big business, and people don't want anyone to take away their cannabis either. So that's another big thing that I've discovered. But if we can just agree that it can be a problem for teenagers and illegal weed can be laced and can be dangerous and deadly, I think we need to agree upon those things.
Oh, absolutely. And I've had parents say to me, Paula, you're fighting a battle that I'm glad I'm not, because my child unfortunately passed away from a pill, or my child passed away from coke. That's easier than the mountain that you're on, because the mountain that you're on, it's like you said, you're fighting a battle that every day I'm having to fight this, because let's face it, the cannabis industry, they give a lot of money to the states. And I know that here in Massachusetts, it was $4 billion last year. I'm not telling you, Mr. Cannabis, don't do what you're doing. I don't care. All I'm telling you is be safe, continue to be regulated as you are federally, but help us to put out this message, because otherwise we could have a Woodstock in a matter of months, days, years. And then people are going to be like, oh, well, we should have put more recognition to this. It's kind of like the whole xylazine thing, right? I lost Andrew 3 years ago. I was yelling and screaming about xylazine and showing the proof. And I was being told, you're crazy. There's no way. What do you mean? And then like a year and a half later, 2 years later, Ann Milgram, the former administrator, puts out an op-ed about xylazine.
And it's been found in every state. I think people were slow to believe that because it was legal in my state, they use it on the big livestock. Right. Ranchers had it, and now it's regulated. And It's just, yeah, I think, and what is the next substance going to be? You know what I'm saying? Like, okay, we've got fentanyl, we've got all kinds of fentanyl analogs, we've got things 40 times stronger than fentanyl being found in some illicit drugs. It just has to end with prevention and education and getting the word out to parents and kids and everybody, and getting people to accept the fact that there's no safe illegal use at all. And helping people who do suffer from substance use disorder, because I'm telling you, no matter if you shut everything down, let's say you could stop all fentanyl from coming into this country, if that's possible, what do you do with the people who are suffering from substance use disorder? What do you do with them?
Exactly.
You know?
And this is where the compassion comes in, right? Like you talked about.
Right. So I wanted to ask you too, before we go, about what you want Andrew to be remembered for, because I do think like the way he died, obviously you get questioned about it, you get challenged about it, and it's talked about because it isn't an everyday occurrence, which is good. But Andrew was not just how he died.
Right.
Can you tell me about his legacy and with the organization, what you hope to carry on in his name?
Absolutely. One of the things I say all the time is, Andrew's legacy is not going to be how he passed away, but how many lives he's saving. And that's what this is about. And it's for all of the angels' lives. It's for your precious daughter's life and so many others, because they did not know what they were being given. They didn't go looking for it. They didn't ask for it. They didn't say, hey, today's the day that this is what's going to happen. They didn't want that. And our children were taken away from us. And one of the biggest things that we constantly say with Achieve Greatness is really, how can you achieve greatness? And whenever I go to, whether it's a basketball event that we're doing or a scholarship we're giving or, just speaking, I always tell people, how can you achieve greatness? How can you make the world a little bit better? Because with my son, if he were still here today, Achieve Greatness would be in every single state, just because of the mission that he had around helping young youth and really helping them to understand that just because you might not be in the NBA does not mean you're not important. You are important. And mental health is huge. And unfortunately, we continue to not talk about that enough.
Well, and mental health and substance use do go hand in hand. So all of it is related, and we need to address all of these issues with our young people in more effective ways. And I'm so sorry for the loss of your son, but I'm so grateful to meet you. And to have this conversation. And you keep doing the good work that you're doing as well.
Thank you so very much. Thank you for having me.
And thank you for listening to this episode of Grieving Out Loud. If you found it helpful, please take a moment to rate and review it, and do share it with your friends and family. Together, we can raise awareness about our nation's opioid epidemic and fentanyl crisis, and hopefully save lives. Until next time, wishing you faith, hope, and courage. This podcast is produced by Casey Wannenberg King and Marley Miller. Are you ready to protect the next generation from the dangers of substance use? Emily's Hope has created a comprehensive K-12 substance use prevention curriculum designed to educate, empower, and equip students with the tools they need to make healthy choices. Our age-appropriate lessons start in kindergarten and build through high school, using science, real stories, and interactive learning to help kids understand their bodies, brains, and risk of drug use. We're already reaching thousands of students across multiple states, and we're just getting started. Visit emilyshopeedu.org to learn more and share our curriculum with your school administrators and counselors. At Emily's Hope, we believe prevention begins with education. Let's work together to keep our kids safe.